Hello, and welcome to REBT Works, where we cover anything and everything having to do with REBT. I am Dr. Steve Johnson, and today I want to look at 6 tips for better REBT homework. We all know that developing good client homework assignments in REBT is absolutely essential for effective rational motor behavioral therapy with clients. One, at a really obvious level, there are many more hours client is outside therapy than inside therapy. So if we can have them practice the skills and the insights that they gain within therapy, then that will better the income, or so the belief is. However, there is now research that shows that that is exactly the case. So let's just jump into it and look at 6 tips for better REBT homework. The first one that I would like to look at is collaborating with a client to develop homework. It is really important that as therapists that we don't develop the homework alone or assign the homework unilaterally to the client. It is much better if we collaborate with the client. There's better compliance if client-related and client-generated homework is in place. In fact, there are a lot of other side benefits to that other than just better compliance, and that is one of the benefits of collaborating on homework is that we help the client develop better listening skills, and in fact, we as therapists develop better listening skills. And then also, the therapist modeling collaboration and cooperation and effective communication with other individuals. So really important that we collaborate with the client to develop the homework assignment. The second point is to develop homework relevant to the issue addressed in the actual session. Let me give an example. Let's say that in an REBT session, we have practiced how to identify the inferences and beliefs associated with anxiety about losing a friendship. How might we include that into a homework assignment? Let's just take some examples there. One is we might have the client, or together we've collaborated on creating a chart that notes the time, the situation, and the inference when they're experiencing anxiety. And so we know that the anxiety, the inferences is about threat, so we'll have them track that. Another thing is to do pretty much the same thing, but this time track not the inference, but the irrational beliefs associated with the anxiety. A third one might be to track the frequency of experiencing anxiety between sessions and the irrational beliefs for each time that's triggered, along with the critical activating event. And then finally, in a way that we really want to heighten awareness of the BC connection, is have the client note the date and time when they were triggered about losing a friendship, and then identify the dysfunctional irrational beliefs and the anxiety or the emotion that is encountered, and we heighten that BC connection in that way. A third tip is nearly always include creating the homework and analyzing the completion and the results. So in other words, what was learned in the homework near the beginning of the very next session. So really highlight the importance of doing this. One of the ways we emphasize the importance of doing the homework is by consistently integrating the homework and discussions of the homework into every session with the client. Another thing there is don't rush analyzing what the client learned via the homework assignment. Give it some time. It's an integral part of the therapy session, maybe even as much as whatever the critical activating event is or dysfunctional emotional behavior is that the client is bringing up in the session. Another issue there is if the client doesn't do the homework, or they didn't do the homework, or they just kind of poorly did it or half-heartedly did it, discuss the reasons the client didn't do the homework without judging the client, and look at the real issues. Don't gloss over them. Was the week very, very busy and they just didn't have the time to get to it? Or, perhaps another crisis developed and took precedence over doing the homework. Maybe it's just an issue of procrastination, and you can see whether that's kind of a theme with the client and address that. Or the client wasn't motivated to do it. And then again, spend time discussing how that was associated with irrational beliefs. And typically we'll see the beliefs that are often in place, the irrational or dysfunctional beliefs that are in place, are frustration, intolerance, or sometimes even global negative self-rating. Another issue under this point is when creating the homework assignment, discuss with the client the reason why the client might not do the homework, and discuss how they might do that and how to address those ways. So, for example, a client might refrain from doing the homework assignment because they have a belief like, I didn't feel like doing it. And so we could look at, well, how is that thought really helping you in terms of reaching your goal in therapy if you just say you didn't feel like doing it? Or, I just thought it's not going to help. What's the use? And so again, what's the functionality or dysfunctionality of that? Or another one is, I'm too weak to do it. I just can't get this done. I'm too stupid. I'm too weak. So we see in those examples of frustration, intolerance, and global negative self-rating, and we will use those as learning opportunities for how to not only avoid not doing the homework, but just improving in the overall REBT model and application to other areas of life. A fourth tip is make sure that the homework is actually doable for the client. And one of the ways to do that is be sure that the homework is short and it doesn't require an inordinate amount of time or skills beyond what have been learned within the therapy. For example, don't do a homework assignment that's requiring the client to debate the irrational beliefs before you've even discussed debating irrational beliefs, before you've even covered that issue. And another thing here, when trying to estimate whether the homework is doable, collaboratively, of course, is to take into account the effects of the dysfunctional emotion on having the homework assignment be doable. For example, if the client is severely depressed and they have lower energy level, then let's take that into account. Or maybe they're bipolar and they're having a manic or hypomanic episodes with lots of racing thoughts. We might need to moderate the homework assignment there. Or the client is put on a new med that causes tiredness and sleepiness and difficulty concentrating. So again, let's look at the realities of the dysfunctional emotion and just the realities of medications and any other factor that may be impinging on whether the homework is actually doable. A fifth tip would be to make the homework concrete and the results observable and measurable. One way to do this is just to avoid vague homework assignments. A poor, vague homework assignment would be, let's say, for example, I'm going to try to call someone this week. That is extremely vague and not a very helpful homework assignment. But we could ask questions to try to make that more concrete, such as, how many people would you call, and how will you choose who to call? What will be the criteria that you will use for selecting the individuals to call? When will you call them? What day? What times? What will you say when you call them? So notice the answers to any of these questions or all of these questions will get more specificity and concreteness. I would recommend, again, always include a discussion about the purpose for the homework and what the value is in having really concrete, measurable, doable homework assignments. And then the last tip that I want to cover is create homework that includes more approach rather than avoidance goals. What do I mean by avoidant goals and approach goals? Avoidant goals are goals where we're trying to avoid doing something or avoid experiencing something, whereas an approach goal is just the opposite. It is about moving toward an activity, doing something, having an experience. And let's take an example here. An example of an avoidant goal would be, I'm going to avoid drinking alcohol this weekend. Okay, that's an avoidant goal. An approach goal might be, I'm going to go on a day-long hike with the friend who doesn't drink. That's an approach goal. They're trying to move towards something rather than avoid something. What's the value then of the approach goal over the avoidant goal? Approach goals are simpler. All you have to do is find one way to get that done, whatever the goal is. Whereas in avoidant goals, you have to think of all the possible ways to avoid an activity, which can make for a great deal of complication and a lot of work. So try to increase the number of approach goals over avoidant goals in the homework assignments. Thank you. These are 6 tips for homework in REBT. And these are just the tip of the iceberg of all the kinds of things that we can do to improve homework in REBT. There are many other issues to consider when collaboratively creating those assignments. So if you want more information, please just check out the website of the Albert Ellis Institute, especially look under the professional training, and you'll find some training that does involve creating homework and a discussion of that. So thank you very much for listening today, and I wish you all a fantastic day. Bye-bye.